We are all human, we all make mistakes. Sometimes mistakes cause harm to mothers, babies, co-workers, or ourselves. None of us want to cause harm, so anticipating and reducing these errors is an important part of making maternity care safer. Delivering care is a combination of humans and the system that they work in. The system is the hospital, computer programs, labs, and everything else which supports that. Safety culture means placing the avoidance of harm at the top of our clinical priority list. The single consistent theme from any evaluation of errors is that humans always have and will continue to make mistakes. Some are in predictable ways, which relate to our instinctive reactions to difficult situations, especially the way we undertake tasks when we are stressed. There are many pre-programmed behaviours and responses within all of us which do not always serve us well in the modern-day NHS environment. Clinical human factors are the way in which we as individuals behave and interact with one another within the workplace. As doctors, midwives, maternity care assistants and managers, we all come to work to give the best possible care for mothers and babies. The study of human factors is the science behind why we make mistakes and how we can apply this knowledge to help prevent these mistakes, avoid their reoccurrence, or to reduce their potential harm. Human behaviour has been shown to be a significant factor in medical error. These errors are usually a deviation from intention or expectation. So, why might women and babies not always experience the best outcomes? The healthcare system we work in has barriers and safeguards that are used to try to prevent mistakes. These can be physical, procedural, or human. Reeson's Swiss cheese model hypothesises that each of these barriers can be thought of as a slice of Swiss cheese, having many holes. The presence of these holes does not mean that a bad outcome occurs. Nearly all adverse situations involve a combination of staff errors, or active failures, and latent unsafe working conditions, known as resident pathogens. Reeson explains that most errors can be grouped into four main categories. Organisational: limited training due to lack of funding, short staffing, broken computers. Supervision: inexperienced staff working with minimal supervision. Preconditions: being tired, hungry, overworked, or needing a wee. Specific acts or active failures: poor communication, rushing specific tasks, loss of situational awareness. As Reeson explains, accidents are usually caused by a sequence of errors in these defences. The holes in the Swiss cheese all line up. It is important to recognise and understand why these errors occur. Using Reeson's model, you can clearly see the stages which can lead to the event of a medical error. For example, in the first instance, you might be unable to get study leave for a suturing course. This would then leave you inexperienced when trying to perform suturing. Additionally, staff shortages not only lead to fatigued and burnt out team members, but can also leave you to work without the appropriate supervision required. All of these seemingly minor factors can play a part in causing you to rush a procedure, such as a swab count. The combination of these minor errors would then amount to the never event of a retained surgical swab. As humans, the compassion, understanding and skills we bring to healthcare are essential, but we all make mistakes. We must learn from these mistakes in order to prevent their reoccurrence.